Hi all, welcome back to our Allied Lecdem channel. In this video, we are gonna see about what is lymphatic system and its organization, drainage and some other lymphoid organs in detail. So let's get into the video. What is lymphatic system? See, the lymphatic system or lymphoid system is an organ system in vertebrates that is a part of a circulatory system and the immune system. It is made up of a large network of lymphatic vessels, lymph nodes, lymphatic organs, and lymphoid tissue. So, these vessels carry a clear fluid which is known as lymph. So, it is a network of tissues, vessels, and organs work together to move a colorless fluid, that is lymph, back into your circulatory system. So, what is the function of this lymphatic system? It helps in maintaining a fluid balance in the body by collecting the excess fluid and particulate matter from tissues and depositing them in the bloodstream. And it also aid in the immune system, that is by defending the body against the infection by supplying a disease fighting cells called lymphocytes. In brief, it is known as T lymphocytes. So lymphatic system is nothing but, as in simple, it is a blood passes through the capillaries in tissue. Some water along with many small water soluble substances move out in the space between the cells of tissue, leaving a large protein and most of the formed elements, that is like erythrocytes and platelets in the blood vessels. This fluid is released out, which is known as interstitial or tissue fluid. It is being collected and drained back to the major veins of the body, that is subclavian vein, to elaborate the network of vessels called lymphatic system. The fluid present in the lymphatic system, as I already saw, it is lymph, and it is a one-way system and allows the lymph flow from the tissue spaces from the towards the blood. This image depicts the lymphatic system in our body and some other lymphoid organs like thymus and spleen. We'll see about the organization and drainage of the lymphatic system. Before seeing that, we should know some of the terminologies like lymphatics, lymph capillaries, and so on. First, lymphatics. It is nothing but lymphatic vessels that already we saw. It is a one-way system and lymph flows only towards the heart. Lymph capillaries. They are microscopic, blind-ended lymph capillaries weave between the tissue cells and blood capillaries in the loose connective tissue of the body and absorb the leaked fluid. And mini valves. It is a self-explanatory. As we saw, it is a one-way system. Absolutely a valve will be present which mimics the property of vein. So, the edges of the endothelial cell forming their wall loosely overlap one another, forming a flap-like mini valves. So, which has been anchored by a fiber collagens to surrounding structures. When the fluid pressure is higher in the interstitial space, allowing fluid to enter into the lymphatic capillary. Next is lymphatic collecting vessels. When the lymph is being collected from the lymph capillaries, it is being transported through a larger vessel which is known as lymphatic collecting vessel until it is finally reached to the largest draining system, that is into the venous system, through one or two large ducts in the thoracic region. Next is right lymphatic duct. It drains the lymph from the right arm and the right side of the head and thorax, whereas the thoracic duct receives the lymph from the rest of the body. So, both the ducts empty the lymph into the subclavian vein of their own side of the body. Next. Now, we'll see the organization of the lymphatic system. Once the tissue fluid enters the lymphatic capillary, that is, it is known as lymph. Lymphatic capillaries merge and form a larger lymphatic vessels. The walls of larger lymphatic vessels are similar to vein, as we saw already. So, they have a valvulus to prevent the backflow. Eventually, the larger lymphatic vessels empty into one of two peripheral vessels. They are thoracic duct in the left or right lymphatic duct in the right. Further, these ducts drains the lymph into the right and left subclavian veins respectively. These veins connect with a number of small veins and drains into the superior vena cava which connects to heart. So, lymph ultimately drains in subclavian veins of either side of our body. So, there are two drainage vessels, namely right lymphatic duct and left thoracic duct, who slowly but contain drains in the lymph and venous system. Thus, the tissue fluid, that is lymph, which is formed by filtration of the plasma out of blood capillaries, is ultimately returned to the major veins or the cardiovascular system. That is, all this lymph flow from tissue space towards the blood and reaches the heart. And in the drainage system, we saw it drains of two things, that is right lymphatic duct by and left thoracic duct. And here we should know one thing, that is thoracic duct drains 75% of lymph in the left subclavian. Next we'll see the situation of lymphatic system. The lymphatic systems are situated in places like deep layers of skin, subcutaneous tissue, diaphragm, walls of abdominal cavity, omentum, linings of respiratory, digestive, urinary, genital tract, and also in heart and liver. Next, we'll see about lymph node. These are the small bean-shaped structure made from a intricately arranged tissue. They have a dual role. As we know, the lymphatic system carries a dual role, both in their circulatory and immune system. These lymph are present in the deep within the body near the lungs and intestine, as well as the surface as seen in the clusters of lymphatic tissue near the armpit and the groin. Now we'll see the anatomy of the lymph node. As we know, the afferent lymph vessel enter the node at the convex side, whereas the efferent vessels leave from the hilum of the concave surface. Every lymph node is covered by a fibrous capsule that also creates a finger-like projection into the lymph node itself. And the infection causes the lymph node to enlarge, leading to conditions like lymphedema or lymphadenopathy, which we'll see in further coming slides. Next is spleen. Spleen is a main important lymphoid organ, which is the largest lymphoid organ, soft, blood-rich organ that filters the blood. And the location. The spleen is located on the left side of the abdominal cavity, just beneath the diaphragm, and curls around the anterior aspect of the stomach. And the function, instead of filtering lymph, the spleen, it focuses its work and cleanses and filters the blood from bacteria, viruses and other debris. It provides a site for lymphocyte proliferation and immune surveillances. But its most important function is to destroy the worn out red blood cells. As we know, RBC has a lifespan of 120 days and it gets destroyed once it enters the spleen and returns some of their breakdown products to the liver. So the main function of spleen to cleanse and filter the blood from other infectious organisms and from the debris. Thymus gland. We know thymus gland is a mass which is found lower in the throat overlying the heart, and the function is it produces a hormone, namely thymosin, and the function is certain lymphocytes carry out their protective roles in their body. And the most and foremost important function of thymus gland is that it produces a primary important lymphocyte cell, that is T cells, where it gets matured. The organ has two lobes, each divided into external cortex and internal medulla. So the T cell maturation is facilitated by epithelial cell of the thymus when they present antigen to these evolving lymphocytes. Next organ is tonsil, containing an antigen presenting cells called M cells. So these cells alert the other lymphocyte cells like B cells and T cells within the organ. The tonsils are located towards the back of the throat at the intersection of the respiratory and digestive passage. So the function is as same as that follows. It as a of main action in their immune system by trapping and removing any bacteria or any foreign pathogens entering from the throat. So what it causes, what are the disease conditions being caused in this place in tonsil is tonsillitis. Tonsillitis is nothing but inflammation of the tonsil carried out this function so efficiently that sometimes they become congested with bacteria which result in inflammation of tonsil becoming red, swollen and sore. Next is Peyer's patches. Peyer's patches is nothing, it's similar to of tonsil found in the walls of the small intestine. The function is the macrophages of the Peyer's patches are in ideal position to capture and destroy the bacteria which is invading the our small intestine, thereby preventing them from penetrating the intestinal walls. Next, we'll see what are the functions of lymphatic system. We saw it has a dual role, that is both in circulatory and lymphatic. We'll concentrate in some of their functions. First is maintain fluid levels in our body. The lymphatic system collects excess fluid that drains from cells and tissue throughout your body and returns into your blood system, which is then recirculated through our body. That is, the blood cells and finally pours the same into the venous system. It absorbs fat and from the digestive tract. Lymph includes fluid from your intestine that contain fat and proteins and transport it back to your bloodstream. That is, it absorbs fat from the intestine. In the intestinal villi, lymphatic capillaries are present, which are called lacteals. The ultimate goal is release the absorbed fat into our bloodstream. Next is protect your body against the foreign invaders. That is, it produces and releases lymphocytes, that is WBCs, and other immune cells that monitor and then destroys the foreign invaders such as bacteria, virus, parasites, fungi and other debris that enters our body. And last function is transport and removes the waste product and abnormal cells from the lymph. Next, we'll see some condition related with the lymphatic system and lymph. There are where the lymphatic system applied physiology can be divided into two common. They are either by water retention in the tissue due to impaired lymphatic drainage or swelling of the lymph node. First condition is lymphedema. Lymphedema is nothing but swelling or accumulation of lymph fluid. It can result from blockage in our drainage system in the lymphatic system caused by scar tissue from the damaged lymph vessels, or is often seen when the lymph nodes are removed from those who had a surgery or a radiation in case of cancer treatment. The buildup of lymphatic fluid is most commonly seen in your arms and legs, in arms particularly in their armpit region. It can be a very mild to a painful series of symptoms may be seen, and people with lymphedema are at risk for serious and potentially life-threatening skin infections. Next is lymphadenopathy. It is also enlarged lymph nodes are caused by infection, inflammation or cancer. The common infection that can cause enlarged lymph nodes are strep mononucleosis, HIV, infected skin wounds, and lymphadenitis refers to lymphadenopathy that is caused by an infection or inflammatory condition. Next is cancers of the lymphatic system. Lymphoma is the cancer of the lymph node and it's one of the most commonest cancers seen in Asian countries and occurs when the lymphocytes grow and multiply uncontrollably. There are several different types of lymphoma, including Hodgkin's lymphoma and non-Hodgkin's lymphoma. Cancerous tumors can also block the lymphatic duct, that is in the drainage system, or by near lymph nodes and can interfere with the flow of lymph through the node, which to be carried into our heart. Okay, we have come into an end. So we'll just recall what are the things we have seen in this video. First, we saw what is lymphatic system. This is a closed system of lymph channel or a lymph vessel through which lymph flow. It is a one-way system, and we saw some parts like lymphatic vessels, lymphatic villi and mini valves, which helps in preventing the backflow of the blood and its drainage. And we saw drainage. There are two important vessels like right lymphatic duct and left thoracic duct, which ultimately drains into a subclavian vein. And some other lymphoid organs like spleen, thymus, tonsils, Peyer's patch, and function. The main function of the lymphatic system is the immune system. It aids in immune system by invading the microorganism and foreign particles in the lymph node. Also, it helps in absorbing fat from the intestine and moving them into the bloodstream. And some other conditions related to lymphatic system like lymphadenopathy, lymphedema, cancers conditions. So I hope in this video we have learned about lymphatic system and it made clear and gave an idea about what they are. So thank you, and we'll meet up in next video. Thank you.